TMS in Parkinson is very promising. In the last few years, a high number of studies have been published, in most cases proving some degree of efficacy, especially on motor symptoms and in general on the Unified Parkinson's Disease Rating Scale Part 3. So it is really promising, especially for the stimulation of the M1 cortex bilaterally. But the main issue, in my opinion, with the TMS is that we don't know exactly the duration of the effect and the maintenance over time. So now probably it is time to shift toward studies assessing not only the short-term effect, that is quite clear that can be good for patients, but the maintenance over time.